my name is Fahad Sheckley. I was born and raised in Baghdad, Iraq. I moved to the United States around 2000, yeah, to January of 2008. I moved with my two other brothers and my mom. We lived in a period of time. I actually was in medical school in Iraq for a year. In Iraq, there's no undergrad, so you go from high school to medical school right away. So I started medical school for 1 year, and then I went to Jordan to live for a couple of years because of the civil war in Iraq. So I started medical school in Jordan, where I had to restart from the beginning again. Same system as in Iraq. They don't have an undergrad, so I started a year and a half, and then when I was second year of medical school, which is a 6 year medical, 6 to 7 years of medical school there, I got a phone call saying our application for the International Organization of Migration was approved and that we were flying in like a couple of months. It was a refugee program for Iraqis. After we moved from Iraq, we were living in Jordan. We didn't have any papers in Jordan at that time, and it was just like me being in medical school. That was like the thing that kept us like that. That I had residency there. My mom and my brothers didn't have residency, so I we got my immigration status. I moved to the United States. My plan initially was to kind of get the green card and maybe go back to Georgia, finish the medical school. I was already in second year, but then it was kind of impossible, especially with the family and all that stuff. So in the beginning, I started working as a dental technician in a dental lab in Orange County, and then in near Irvine. And my brother at that time, he's my younger brother. He was introduced to Dr. Rastogi through another person, and then he started working as volunteering. And through my brother, I actually was introduced to the entire, like the nephrology department at UCLA with Dr. Rastogi there at that time. So I was working there, and then in the beginning I came as a volunteer. It was like in the beginning I was like I didn't know what I'm doing, like I was interested in going to medical school. I didn't even I wasn't even sure what I'm doing, or should I just like start undergrad from the beginning, because at this point I can't go medical school directly here, obviously. So finally I decided to restart again from the beginning as if I just graduated high school. I took few classes in a community college because I didn't have my SATs or anything. I mean, I never finished high school. I started some classes in community college, and then transferred to UCLA 2010. I transferred to UCLA. And then, yeah, so I got introduced to Dr. Rastogi at that time. I remember Christina had just started also, so at that time, so we kind of started around the same time, me and Christina. Uh, and My brother was there. So we started working. In the beginning, I remember there was a study about tolvaptan. It's a medication that we used for polycystic kidney disease, and this medication was not FDA approved for polycystic kidney disease at that time. And UCLA, Dr. Rastogi was one of the investigators of this medication. So that was my first study working on. And we worked in other studies, but for some reason, I kind of found myself with polycystic kidney disease. And that was also personally, my first introduction to kidneys in general. Like I didn't know what I wanted to do to go into medical school, even like later. I mean, like in Iraq and in Jordan, when I was going to medical school, I didn't know what I want to do in my life afterwards. I wasn't really interested in a specific subject. I was maybe interested something surgical, but I didn't know. So that was my first introduction to kidney health in general. Dr. Rastogi was always like kind of like telling us about the kidneys, and like he introduced me to the kidney health. And I remember he always asked me to kind of read about the kidneys familiarize yourself with the kidneys, because when I'm getting this study, like you start polycystic kidney disease, what that disease is, I didn't even know. Like, like it was like something that was brand new to me. I didn't know that there was such a thing that time. Even after a couple of years in medical school, I didn't know what polycystic kidney disease is. So I started working on it. I started like reading a lot about it, and I kept going with that throughout my undergrad. I graduated 2013 from UCLA. My major was physiological sciences and phi-sci. Are you guys all UCLA students? All right, awesome.
Yeah.
So I did phi-sci at that time. There was a big focus on anatomy in phi-sci. So I was, because I was a little bit I had a benefit of like going to medical school, so in Iraq and in Jordan. So I was already introduced to anatomy there. So when I did undergrad, I was an undergraduate assistant for anatomy lab, and then even after I finished, I was a teacher assistant for the anatomy lab. Um, I worked with Dr. Phelps, and and but at the same time, I was with Dr. Rastogi, and then I had just finished. I was like going there like, I think twice, three times a week, and I kept going there. I was like, we grew the 12-aptan study. We started another study for Cadmon. It's called Cadmon. I don't know if you guys know this study, but it's also polycystic kidney disease. And at that time, my brother was there and I was there. We got a couple of other friends who were also in the medical field from Iraq were there. We kind of like, we like, like there was a big community of foreign medical graduates were there. Some of them are nephrologists right now at UCLA. Dr. Corson, I think, Dr. Christine Sarmosian, I think, was there. Yeah, they were all like part of these studies, and they are all foreign medical graduates. So I was in like Dr. Rastogi was always like kind of he built a nice community where I was, like I got in like these people helped me a lot throughout the process in understanding medicine because they already graduated medical school. Dr. Rastogi as well, and he was always like motivating us, pushing us to learn a lot about the kidney disease. And after I finished undergrad, I was looking for a job at that time because I took I didn't take the MCAT yet at that time, so I was like decided to take a year off to take the MCAT. It was extended to 2 years. I said a week off. I mean a year off to take the MCAT, and then it was extended to 2 years because I think I took the MCAT once. I didn't do so well with it, and I decided to push it another year and take the MCAT again. So Dr. Rastogi offered me a job at that time because I was already involved with these studies. I remember like with Christina and Dr. Rastogi, they both sat down with me and they said, you got to work with us. You're like, and then they kind of like offered me, it was like an easy yes for me because I was like, I already love the community there. I already love the people there with Christina being like organizing everything and like leading everything. And it was like, um, and Dr. Rastogi, obviously, with his guidance there. So I started working, and then Dr. Rastogi was always talking about this idea about, bringing in like the young blood, to kind of create this core kidney to kind of educate people with like different diseases, also with like polycystic kidney disease. And I remember these ideas were kind of sprouting at that time. And, in the beginning, we thought like, I thought it was just an idea, I didn't picture it to be like a reality as it is right now with the core kidney. And then Christina and Dr. Rastogi really led the way to do that. And I remember we started there was a fair, it was in on the Santa Monica by the pier, right outside. We started like we got this like that kind of area that we started promoting for health for like different things in kidneys. I kind of sat in a like basically in an area where I was educating people about polycystic kidney disease, other people about diabetes and its effect on kidney disease and all that stuff. And such a small idea became like really this big thing. And it was the first time when we were sitting in Santa Monica, and then we saw how many people were actually interested, how many people showed up and supported this whole idea. And from that moment, really, I was thinking, oh my God, this thing is going to be really big. And, for Dr. Rastogi and Christina, they actually like really like continued like dedicated themselves to this idea, and it grew to the level that I see it right now. I still see all these emails. People change, people come and go, but the idea and Dr. Rastogi and Christina are still there leading it and becoming this big thing. Um I continued working there throughout the entire time I was studying for the MCAT. They were actually a really big support throughout this time. And we did multiple studies. We finished the tolvaptan. It got FDA approval for polycystic kidney disease. I was like, we were the highest recruiters for the CADMON study, which is another polycystic kidney disease studies. There's a lot of other studies. And at that time, I applied to medical school and I got in. I got into Beaumont, Michigan. And at that time, it was the reality. It was like I had to move, but it was, for me moving to the next step, but it was like really sad leaving this place, leaving the people over there that I worked with. Um, my youngest brother also came and joined when I left. I also I brought some other people who also started working there. And I mean, the whole thing was just such a small thing, eh, and then it grew to this level, and it affected me personally because it really kind of directed my way of thinking in medicine. And Dr. Rastogi's guidance always structured my thought process on how to kind of get to where we want to, And he always encouraged me. He always encouraged me to read about the kidneys, but it's also an encouragement to read in general about medicine and learn it a lot. And when I was in medical school, it's for medical school is only 4 years, so you have to make a decision on what you want to do. And I loved the kidneys so much, and I was kind of interested in the surgical field. So I decided to explore urology, and there it is. I mean, I decided to apply for urology. Um, Throughout my application process, the whole thing working with Dr. Rastogi and with Christina at UCLA, it didn't only like help me getting to medical school, but it also helped me really getting to residency. And urology is one of these really competitive fields. But if you look at my CV for the urology application and all the research that I did regarding the kidneys and my involvement with the kidney research, they all were like, I remember my current chairman. I worked after I graduated residency, I worked in the same place, and my current chairman who interviewed me for the urology residency, he was looking at the application and he was like, "Oh my God, you did all this about the kidneys." I mean, and they matched me. They ranked me number one because it was like they saw how much I love the kidney. They saw how much studies I was involved in with the kidneys, and it really helped my career. So I really give credit to that to Dr. Rastogi, Christina, and the whole UCLA core kidney, because it was a really big part of my career. And here we are now. Yeah, I graduated. I graduated medical school 2019. Started residency 2019 in New Jersey, Hackensack, New Jersey. And it was during COVID year was my intern year. It was a crazy year, and then finished in 2024, graduated, and I've been working here in the same place that I did residency for the last couple of years now, and it's been great.
So, Dr. Sheckley, you've had the
Yeah.
perspective of seeing core kidney from its very beginning to where it is today. Uh,
Hmm.
what do you remember most about core in those early days that you just told us about, and what stands out to you most about its growth and evolution?
So when I first, when the idea first started, and Dr. Rastogi was like hoping that his aim was to kind of first educate the youth and like to kind of tell them about what this is, and to also educate the patients, that which is the most important thing, is to the patients were like really had no knowledge of the diseases that they're being diagnosed with, and us in the core kidney, we were the people who educated them in the beginning. So it was such a really good way of educating two fields, two types of people: the patients and the people who are going to take care of these patients in the future. And that really stood out for me because the focus was not only on one thing, really. Just this general idea of teaching about the health of the kidneys and in general. And for me, I was like really kind of almost leading the way in that, in the polycystic kidney disease. I was taking care of all the studies there, so I was like really talking to a lot of people about polycystic kidney disease and what it is. So yeah, that really stood out for me, that it's such an educational opportunity for all, for us in undergrad when I was in undergrad at that time, and for the patients.
Thank you, Dr. Sheckley, for that answer. I just
Yeah.
wanted to get a little bit more um, perspective on how you think organizations like Core Kidney are so important in bridging clinical care with community education and advocacy. I know you talked a little bit about the fair that you were involved in 2015, but if you could expand a little bit more on that, that'd be amazing.
Yeah. So I mean, look, that fair, it was only that first year that I was there, and then I think I left. Did I do another one or not? I can't remember. But through that fair, and it was the first fair that we had for core kidney. Um, there was the turnout was amazing, and so in the beginning we thought like, oh my god, this is, but then you start thinking about it, you start maybe, oh, it's just the first year, how things like kind of fade away. But no, you can see like, and I was following it, I was getting the emails, I was like, I'm still like getting emails about core kidney, I'm still following it on social media and like the Facebook group. And you see people, actually there's actually also in the Facebook group of the polycystic kidney disease, that is called the Fight Against ADPKD. I think it's a group that was created by the Polycystic Kidney Disease Foundation, and they always talk about core kidney, and you can see the influence of the core kidney in the education of patients. And I'm talking from my perspective about the ADPKD. There are other parts of like kidney health, in terms of dialysis, in terms of living kidney donor, the transplants, in terms of the influence of high blood pressure and diabetes on kidney health, Fabry's disease, all this stuff. These are like diseases, syndromes that affect the kidney, and there are people who are affected by all these diseases, by like like some people from Fabry disease, some people from ADPKD. Some people are who are transplant patients, and they all benefited from the core kidney. And so I saw that. I was like, I saw that from a small idea into like this influence that it has on these people. It gives hope for these people. It gives an opportunity to learn, because when you learn, you kind of know what options you have, and when you know the options, that's what gives you the hope you know
Wow. Truly hearing your
Yeah.
story from beginning to end has been like extremely, extremely inspiring.
Thank
And I kind of also, since we focus so much in nephrology here at Bruin Beans, we don't get much perspective, or like we just haven't had the chance to look so much into urology. Could you explain to us what urology is and why you made the distinction between specializing in urology versus nephrology?
So urology is a field, is a surgical field that treats any problems with what we call post-renal problems. So there's something called pre-renal kidney disease, and pre-renal kidney disease is things that affect the amount of fluids that get into the kidney. The perfume, the you know, the kidney is a filter of the body, right? So how much fluid is getting filtered, that's a function of kidney, and it's a pre-renal problem if there's any disease. For example, high blood pressure, diabetes, and there are so many diseases that affect the kidney function. Now there are sometimes the kidney is working fine, and there's the patient that doesn't have like any influence from the pre-renal. There's good fluid coming into the kidney, but the problem is with the drainage of the kidney. If the kidney drains into the tubes called the ureters, into the bladder. Now, if there's any problem with the drainage of the kidney to the ureter, or there's a problem with the bladder, or there's a problem with the prostate, which sits under the bladder in men, that doesn't help with the drainage of the kidney, that's what urologists are treating. It's a surgical specialty, so basically, if there is any, uh, problems with the prostate enlargement causing blockage of the kidney down the flow, down the drain into the bladder, then that's when we treat the prostate. If there's kidney stones, that's when we treat the kidney stones, because the kidney stones could block the output of the kidney. In addition, could be tumors in the ureters, tumors in the bladder that could cause a problem like this, like bladder cancer or urothelial carcinoma, which is the cancer of the ureters and up in the inside lining of the kidney. It's called the collecting system. In addition, there are kidney cancers, kidney tumors that we have to resect, and that's not necessarily affecting the kidney function in any way. It might not affect the kidney function, but it's cancer. It's being there. We have to resect it. So we have to remove that cancer. We have to kind of, in certain situation, we do partial nephrectomy, which is just removing the mass to preserve the kidney function. It's called neuron preserving surgery, or kidney preserving surgery, because you want to preserve the kidney function of that side of the kidney. Let's say a mass in the left side of the kidney. You want to keep that kidney, especially if the other kidney, the right kidney, might not be the best function, right? Then you have to kind of figure this out. Or a patient with solitary kidney, with one kidney, then you have to make sure how to preserve that kidney, but at the same time remove the cancer. So that's called partial nephrectomy. Or if you do a radical nephrectomy, then you understand that his kidney function, patient's kidney function, might get affected, and that's when we talk to our friends in nephrology to kind of help us with this as well. So it's the nephrology and urology. There's a lot of overlap between them. There's a lot of coordination between us to deal with things.
You
Yeah.
have two brothers, right?
Yeah,
And
two
one
brothers.
of
They
them,
both worked, yeah, in the
and
office.
yeah, how did they find themselves at Dr. Rastogi's office, and how did they introduce you? What was that like? Like, I understand that
Yeah.
you immigrated and then you started undergrad, but like what did your brothers say to you at that time?
So in the beginning, there was our friend. Well, he's my brother's friend's family. His name is Mohammed. He was actually working with Dr. Rastogi in the beginning. He was one of the first people to work with Dr. Rastogi. And so he's the one who introduced my brother to Dr. Rastogi. And at that time, we both were working at UCLA. I was actually volunteering in the neurosurgery department. I think it was in the Ronald Reagan building. It was like in the hospital itself. It was in the fifth floor or something. I can't remember. But I kind of didn't really enjoy my volunteering there. It was I think that it was not as educational. It was not like, you come in and no one knows what they want, what you should do. And you're standing there, you want to help, but you don't know what to do. So but I saw my brother was pretty involved and he was already working. It was like almost like, even though he was a volunteer, he was almost like an employee there. He was like putting a lot of effort as well, and dedication. And by the way, he also he went to medical school eventually, and he's a general surgery resident right now in Arizona. So he said that, you know what, you should come volunteer with us. Like, the office is so busy, there are so many studies. I'm pretty sure there's something you can do. And I was really interested in doing something, because I just didn't, like, I remember in the neurosurgery department, they wanted me to do something that has nothing to do with medicine, that has nothing to, like, not even helping people, not even, it was something like, I don't know, shred papers or something. That's it, which is fine. I mean, but like in the beginning, but it was not moving. It was like nothing beneficial for me or for patients or for anyone. So I was like, you know what? Let me do that as well. So when I came in, volunteered, day one, I was already thrown into like a study. Go help with this study. Read the IRB. I read the IRB. I was like, I don't understand anything from what I'm reading, but sure, you know what, with some help I started understanding. And yeah, and then when I left, my third brother actually also joined, so we're all graduates of core kidney. My third brother, he went to dentistry eventually. Yeah, so we all did that work. We all worked with Christina and Dr. Rastogi.
Oh, that's really fun. I feel like a lot of the
Yeah.
volunteer programs make us do stuff like that still, like shredding papers and
Yes,
stuff.
that is true. Like, shred these papers. And I thought, like, in the first few weeks, I was like, okay, I'll do that. So hopefully, like, they see that I'm working harder. I'm like, and I was helping maybe with like, but then nothing else was moving. I'm like, okay, can I help with anything? No, you can go home. I'm like, well, I don't want to go home. I want to learn. But yeah. So, but yeah, for Dr. Rastogi, as I said, first day, it was like right away, put on like the helmet and start working.
Yeah, I feel like we're in the same shoes as you were like a few years ago. Like, would you have any advice to us, like as Dr. Rastogi's students, and also since we're also looking forward to pursuing medicine?
Yeah. So know what you're doing over there. Like, not just like, you're taking care of a study, or like read about it, read about the kidney, understand them, understand how they work. Because this way you understand what the study is. In the beginning, when I first started working on tolvaptan, I didn't know what it is. I mean, and then I started reading about the IRB, and then I was kind of, there are some words that even though I went to medical school before in Iraq, but I was like, I didn't really understand what I'm reading. And then I started actually Googling and reading about these things, and watching YouTube videos about it. And I learned a lot about the kidney at that time. And so definitely, like, not only, you know, it's an education for you. It's not only to help people, but it's to help you as well. So it's a really, if you look at the overall picture, it's helping everyone. This core kidney idea is is a really important thing for the patients and for the students. I used to, when I remember when I was educating people about polycystic kidney disease, and I used to see patients. We did like, I was a research coordinator. We had to like give them the medication. Like, whether it's the placebo or the actual medications, we had to take. I used to take their vitals, do their EKGs, and all that stuff. And I'm educated. So patients used to ask me questions. Sometimes I don't know the answer to. I'm like, I'm gonna ask Dr. Rastogi and I'll get back to you. But then it was an opportunity for me to learn too. So for you, trying pre-medical and trying to go to medical school, these things will help you a lot in medical school, especially in classes like physiology or like biochemistry and anatomy for the kidney, these things will help you a lot.
Wow. I
Yeah.
I really do appreciate like how much core kidney like shaped you in the early days. It's like it's
Yeah.
so interesting because it's like a parallel with between yourself and us right now. Because some of us, Rain and Sid actually are seniors. They're in their final year getting ready to apply as well. So I'm
All
just
right.
seeing
Awesome.
them like matriculate all throughout Bruin Beans and core kidney. And they're going to be applying just like you did. And we haven't have like post grad opportunities to work with Dr. Rastogi still. So it's so similar. And honestly, it's like
It
inspiration. You've come
is.
so far.
I mean, yeah. I mean, it's been. I started 2010, 2011. It's been 15 years now, and in 15 years, I learned so much. And really, my advice to you guys is don't give up. Sometimes these MCAT, my MCAT was, you know, for me when I first took it, and I did terrible in it, terrible. and I still remember actually that's actually something that I just remembered. I did really bad in my first MCAT, and I was like, I was almost losing hope in medicine. Even though I went to medical school in Iraq, I was like, did I make a bad decision? Maybe I should have gone back to Jordan and do like the to finish medical school and come back take the USMLEs. And I remember I was really sad. I was kind of like feeling really down. And my brother, uh, who was applying after me, so he hasn't taken his MCAT yet, but he saw how I was going really down, and was feeling really kind of down. And then he spoke with Dr. Rastogi actually, because Dr. Rastogi noticed. And Dr. Rastogi called me to his office and started encouraging me. He gave me some really wise words about not giving up. He also shared his experience with me. And you know what? Like, it really motivated me. It kind of woke me up. I was like, you know what? Yes, that's not the end. Just taking it one time and it's bad. That's not the end. I took it again, and there we go. It's like all was in the past. So, look, don't give up at all. Like, you do bad in a test, it's okay. It's not designed. Honestly, a lot of like most people who are medical in my medical school, they took the MCAT at least twice. Okay. So you take it once, you don't do well, take it twice, you don't do well, take it the third time. Okay. And by the way, I did so well in my, when I did the MCAT, when I used to take it, it was out of 45. That's not the new version. It was like really old version that like, there was verbal reasoning, 15 points. Biology was 15 points, and chemistry and physics were 15 points, like together, chemistry and physics. So total was 45. So in the first test, I did bad in all three of them. In the second test, I did really good in physics, chemistry, and biology. I still did terrible in my verbal, but I still applied for it. And believe it or not, like medical schools, they start kind of, they understand this verbal reasoning at that time was like something that they were thinking of dropping. I don't know what happened to it now, but they didn't really care for it. And despite my low verbal score, I got multiple interviews and I got into this medical school. So I was really blessed. So you guys are gonna do great. Don't worry. As long as you put the dedication, like believe in yourselves and believe in second chances, yes, you'll get it.
Thank you so much, Dr. Sheckley. It's truly inspiring to hear that coming from you. And I'm gonna be MCATing this summer, so this is what I needed to hear.
Yeah, yeah. Don't and like just kind of relax when you read it. Don't stress out about it. Just
Of
enjoy it.
course.
Enjoy it really because at the end of the day, it's like it's something that you're doing just to do something that you like at the end. So
That's true.
yeah.
So you've answered actually like a lot of the questions we have prepared for you, and we really wanted to frame your whole story from your immigration and the bountiful education that you received here at the US and all of the great work you have done. Is there anything else you would like to add that we may have not touched on?
I mean, take like again, Dr. Rastogi and Christina, they really guided me. They really helped me throughout my career. So definitely, if you have any questions, don't hesitate to ask them. Don't hesitate, like Dr. Rastogi, like he will share his experience, as I said with you. My point here is that, talk to people with experience, talk to people who like went through the same thing that you're going through right now, and they will help you. They will help you because and you know why they will help you? Because they went through the same thing that you did, that you're doing right now, and they know exactly what you're going through.
Hmm.
So definitely get guidance from them. And always remember that you're doing this to help people at the end, to kind of heal people, to help to treat people, to understand their diseases and explain it to them and help them managing it. And that's the main goal of medicine.
Thank you for that really
Yeah.
inspiring perspective, Dr. Sheckley. We definitely are very
That's
grateful
it.
and very lucky to be in the position we're in. And I had one more question for you.
Yeah.
What excites you most about staying involved with initiatives connected to core kidney moving forward?
Yeah. So, look, as I just mentioned, as I just touched upon, it is something that helped me, helped me personally, and I think once you actually kind of learn from it and benefit from it, and you understand it, and you understand the goal of it and how it helps people like patients and students. When you get to the level, you have to appreciate that idea. You will understand. You can once you achieve it, once you get there, once you become that specialist, that after medical school, after residency, after fellowship, now you look back and you're like, there are people that helped me throughout the way, and I don't know, consider it as a payback to that, because it's not like a payback as in debt or something. No, don't take it as a debt, but take it as an appreciation, and the same way that I had people like Dr. Rastogi, Christina, and people like Sarmosian, and these people, like all these people who are ahead of me and like helped me throughout the way. um, you want to help people who are in the same positions as you are, right? So you want to help the people who are going through the same process that you went through in the past. And that's what kept me involved like when Dr. Rastogi was like, me and Dr. Rastogi, every now and then we kind of text each other. And Dr. Rastogi, the other day when he texted me, he said, "Do you want to be involved with this?" I was like, "Yeah, absolutely. This is something I'm like really excited to share my experience, and I hope that this helps others. If it helps one person, I'm so glad." If you guys have any question or anything, don't hesitate, please. And
Of
good luck to
course.
all of you. And thank you for being involved with this.
Thank you so
Thank
much,
you.
Dr.
Thank you so
Sheckley.
much, Dr.
Thank you.
Sheckley.
All right.
Really
Thank you,
appreciate
Dr.
it.
Take
Sheckley.
care.
Have a great
Thank
night.
Thank
you.
you, Christina.
Okay.
Bye. Take
Bye-bye.
care. Bye.